That's the first time that's ever worked. Never worked with my wife. She says, oh, don't be silly, go away. Fabulous. So we're going to start. I didn't realise it, but do you need seats? Okay, perfect. So what we're going to do this afternoon is we had all the theory stuff this morning, and I wanted to show you the lecture this morning should have gone on for another hour, but it didn't. So what I want to do is how do we apply that in my clinic? So what we've got here is a mother. There, this is a mother, okay? And this is her son, Fred. Fred's got to have a little operation before we actually go ahead this afternoon, so you might hear some screams and things, okay? So what we're going to do is do a consultation, examination, and if there's enough time, I'll show you on the big screen some of the computer programs I use to stimulate, afferentate specific areas of the brain. So rather than do it all sort of academic stuff about neurology, we're going to actually do a consultation, okay? And so this lovely lady, has volunteered to do the job. So as soon as you get your chairs, or you can dance if you want to, you've got enough space, we'll make a start. So you get to sit over there.
Oh, what now?
Yeah, now, in front of everybody.
How exciting.
Okay. Yeah. So this is Fred's mum. Fred, you sit there and behave. Okay. Now. So what I'm going to do is go through a standard consultation, and I'm going to explain as I go along the significance of the data I'm collecting and the questions I'm asking. Because I can ask questions and you think, why would he ask that? So I want to find out, okay? So we'll imagine that I know all your detail, I know who you are. I want to know the address. Why would I want to know the address? Why would that be important? Yeah. The French don't use the DSM-5. They've got their own system. And what they want to know is about the whole, child, their life. Where do they live? Because obviously if you live in a tower block, the child's going to have a different early life from a child living in a chateau with acres of ground, their own pony and all the rest of it. So there's going to be lifestyle things. So I want to know where this lady lives. I will obviously want to know about the child, their age, their date of birth. So I need to know where they should be in terms of development. I need to know, are there other children? Because that will, are you the youngest child, the oldest child? Do the other children have any problems, whatever? So we need to know that. I need to have a brief idea of who they've seen so far. Has there been a paediatrician involved? Have they seen OT, speech and language, whatever? Okay. I need to know the family setup. So I need to know, are you married? Are you a single mother? Has husband left? Are you divorced? Was the divorce amicable? Because I could set up a treatment plan, but the child goes to dad at the weekend and he's not going to do anything that mum does because it's rubbish. What would that guy know? He's an idiot. I know better. I know what my child needs. And so there can be terrible conflicts. So we need to know about where the child lives. We need to know about the mother's health. So we'll start at that point. Your health throughout your life, good, moderate, poor.
Good, I would say.
Okay, so this lady, because this is being recorded, we're going to keep her anonymous. I don't know who she is. I just went outside, found a woman, grabbed her, brought her in, sat her down. Right? So, but the answers she's going to give me are going to be honest. They're going to be real. Okay? So your health has been good?
Yeah.
Okay. Now, why do I need to know that? Because the health of the mother will influence the health of the child. There's been some really interesting studies done, and there's a lovely story. There was a guy in the north of Sweden, And he was in charge of recording everything, births, deaths, marriages, but they also recorded the weather and the harvest. So they had all this information. And he was going to retire, and he collected all this information, and he thought, what do I do with all this lot? So he contacted someone at Cambridge University and said, look, I've got all this stuff, are you interested? And he said, yes, right? So the Swedish study went there, and they've used it along with like the studies that are going on at 9/11, in America, to see if your mother or your great-grandmother or your great-great-grandmother, if she experienced a famine or a war or whatever, would that have affected her? So would great-grandmother affect grandmother, and they found, yes, it does. And what they found in the American study so far is that the mothers who were pregnant at 9/11 by the Twin Towers when it all kicked off, their children, along with the mothers, have raised cortisol levels. So they're more stressed than they should be. So they're now waiting for the children to grow up, and then they're going to check the children's children to see if they have raised cortisol levels. So if you or your mother or your grandmother went through a really terrible time, it will impact upon the child. So we need to know that. So your health is good. And how old were you when Fred arrived?
29.
You told me you were 26 when I was chatting you up last night. Lying toad. You were 29.
I was.
Okay. Health of the father, good, moderate, poor.
Good.
Okay. And how old was he?
29.
I was hoping you were going to say he was a toy boy, but okay. Good. Is there any family history of neuropsychiatric disorders? Anxiety, panic attacks, depression, schizophrenia, bipolar?
No.
No. Okay. Why is that significant? Well, basically, nobody really knows why people get things like schizophrenia or whatever, but the research is looking as though it's the same pathway as why we get learning and behavioral disorders. So there's often a link and there's often a family history of depression, anxiety, bipolar stuff going on in the background. Is there any family history of learning or behavioral disorders?
How wide are we talking?
Wide as you like. The problem we got here is that if you go back a few generations, we weren't politically correct, were we? We talked about the clumsy child, we talked about the village idiot and all this sort of stuff. So quite often you say, was there a history of this, was there a history of that? And people don't know. So tell me.
Okay. On my mother's side, this is a bit complicated. Her cousin's son has a diagnosis of Asperger's. My mum's sister's grandson has dyslexia. There's nothing on my dad's side. On my husband's side, his cousin on his dad's side has Asperger's, and his cousin on his mum's side also has a diagnosis of Asperger's as well.
Okay. Now the thing is with genetics, you can have the gene for something, but you don't have to actually have it. So had the thing gone on a bit further this morning, I would have shown you some pictures of agouti mice. Now agouti mice are yellow, they are incredibly rotund, and they always, I'll underline that, always die from diabetes and or cancer. And they did this experiment, this was in the early days of epigenetics, and they changed the diet and they gave the agouti mice folic acid. Now, most women are advised to have folic acid. Why? It reduces the likelihood of genetic changes. So you're less likely to be born, to give birth to a child that's deformed in some way. So with the agouti mice, they changed the diet, gave folic acid, and the babies were little, brown, and didn't die from cancer and or diabetes, nor did the grandchildren. So with the epigenome is protein switches that basically turn on, turn off genetic expression. So when you're a little blob in your mummy's tum, something's got to say, hey, we need ears, we need eyes, we need a nose, right? You can't get 8 months into the pregnancy and suddenly say, bloody hell, no legs. You know, you've got to get everything in place at the right time. So we start off developing in the womb, but then from birth, we have to grow physically and inside mentally. And so genetic factors are really, really important. Now, that's Asperger's on both sides of the family, yeah? And as I said earlier, there are signs which are very, very obvious. You pick up that everything happens too fast in the development of the child that goes on to have Asperger's. So that's a fairly hard and fast rule. So if mum's sitting there, beaming smile, oh, sitting at 4 months, didn't crawl, walking at 9 months, talking full sentences by 18 months, thinking something's wrong. So you need to pick up on these things and understand. My old professor said I could teach he was confident, I could teach a chimpanzee to do what I do, but would he understand the results? The chimpanzee doesn't, I don't, I make it up as I go along. No, so you ask questions, you do tests, but you've got to know what the answers mean, what the results of the tests mean. Otherwise, you're just, killing time. So very important to understand.
And if you didn't have the genetic history, someone wouldn't know the parents or grandparents, you'd still be able to work with them.
Yeah, I mean, you can, but I mean, you've got, you try and pick up evidence in other places. Yeah. Okay. Any history of miscarriages, stillbirths?
No.
No. Okay. Why would I ask that? No, because the thing is that nature doesn't want to make mistakes. It tries not to. And so if it feels that something is not going to be fully viable, it makes that decision to stop. So it sounds cruel, it sounds very sort of, oh, you're so horrible, but it's a factor, If you watch wildlife films and you see this beautiful little creature and you think, oh, isn't it lovely? And then this lion comes up and eats it, you go, oh, get off, right? But that's nature. Nature is cruel, but in a way, it's how people survive. Okay, what was your occupation pre and during pregnancy?
School teacher.
What did you teach?
Music, secondary.
Okay. And what was Dad doing pre and during pregnancy?
Dad works 90, so kind of time. God, it's a question. I feel like friends. What did Bindu? Yeah, he was a programmer and a management team.
Okay.
So yeah, working
Okay.
at the computer screen and
Okay.
doing stuff.
Okay. So why did I ask those rather personal questions? Yeah. But also, was she using dangerous chemicals? Was she involved with radiation? You think back a while, dentists used to throw radiation about all over the place. And on a few occasions, I've said to people, dentists, how much oomph is this kicking out? They go, what? Rads, how much irradiation is there? They go, what? Now, part of my training is I had to learn how to use X-ray machines and understand how the whole thing works, which terrified me because I couldn't do physics. It was one of my nightmares as a child, can't do physics. But radiation physics, I found, was an absolute doddle, thankfully. But a lot of people don't understand. So I could have been damaged by radiation, you could have been. Also, as you said, we want to know what she's doing because putting it bluntly, it's going to affect her income, where she's likely to live, who she's likely to marry. Yeah? So there are all sorts of factors you need to take into consideration. So you weren't damaged by radiation or dangerous chemicals. Good. She's obviously filthy rich. Okay. During the pregnancy, just with Fred, did you suffer any physical trauma?
No.
So you didn't fall down the stairs, you didn't have a car crash?
No.
No? Okay. Any mental stress, death in the family, moved house?
Moved house quite late in the pregnancy.
Was it stressful?
Not really, no.
Okay. Again, physical trauma could affect mum, her pregnancy, how she copes with pregnancy, how mentally she thinks about the pregnancy. Also, she might have been beaten up by her husband. I worked in North Africa and I just couldn't believe some of the stories I heard. There was one girl who wanted to marry this man very much, and he was a much older man, and they got married, and he didn't want to have babies, and she got pregnant. You know, it makes it sound as if it was deliberate. She got pregnant. Well, you know, it does, because I think most of us here know how we make babies. Yeah? Yeah? I mean, I personally go to Harrods and say, I'll have that one. But I gather there's a thing you have to do. But anyhow, she got pregnant, and both he and the mother-in-law used to beat her, and I mean beat her, and when she fell to the ground, kick her in the stomach. So would you call that a traumatic pregnancy? Yeah. So I need to get this lady to trust me, to be confident, and to tell me things. And if I think, look, she's looking sad, then, not with obviously all you lot here, I would then probe a little deeper to find out what exactly went on. Because we really need to know. Okay. Any viral or bacterial infections during the pregnancy with Fred?
No.
Okay. Again, we're looking for possible stressors, because any stressor, it can be physical, it can be mental, it can be a disease that you have, that will stress the individual, and it doesn't matter whether it's the child or the mother, it's going to affect how the brain functions. Because stress is right brain, and once the right brain kicks in, the sympathetic nervous system kicks in, then there's all sorts of chemical consequences going on in the body, which will influence the mother and her developing baby. Okay? Excessive vomiting.
Yes.
She's only saying that so she can be like Kate Middleton. Okay? She wants that sort of royal sort of thing. Oh yes, we suffered from that. Yeah? Bad?
A lot, yes. I was hospitalised at 7 weeks.
Is that just with Fred or the other children as well? Because I think
Fred.
you said you had 12 when I spoke to you earlier.
No, Fred. No,
Okay.
Just, 7 weeks.
Yeah.
Yeah.
Okay. So again, that's a stressor for mum. I mean, if it happened to me, I wouldn't. I hate vomiting. I'll do anything not to vomit. So to think I've got to do this for 2 months, 3 months, 4 months, no. That's why I go to Harrods. Okay. Excessive weight gain.
No.
No? You okay with talking like this?
Yeah,
Is
no,
it-
it's fine. It's fine.
Because you may have said, yes, it's a good idea, and thought, no.
No, it's fine.
Diabetes.
No.
Okay. You obviously know about gestational diabetes, that you can develop diabetes, or you could have had diabetes beforehand, and that can affect the mother and the growth and development of the baby. Anemia.
No.
No. Same thing. Bleeding, spotting.
Yes.
Okay. For how long? How much?
Tended to be after 20 weeks, and then after my due date, I was taken to hospital because I was spotting, and they kept me in for a couple of days and then to induce me, but then
Okay.
actually...
Okay, so why am I asking that question?
Because it's worrying.
Yeah, but what else? What is it telling you? Where's the blood coming from? So we need to know this information because, you know, it's really worrying for her, because the last thing you want to do is have blood coming out from that part of your body. And, you know, because you're focusing on having a baby, which it's got to be healthy and all the rest of it. So you don't want anything to go wrong. But what does it mean for the baby? Where's this blood coming from?
There's blood within the nutrients.
So we need to ask these questions. Did you suffer with any problems with your blood pressure?
No.
No, that's okay. A lot of ladies do have blood pressure problems, and it can impact on the mother's health and the baby's health. So we need to know that. Protein in the urine?
Not that I remember.
Okay. Convulsions?
No.
It's rare, but sometimes mums have epileptic fits. So we need to know about that, because that obviously affects the mum and her brain, but also the baby who's saying, oh, what the hell's happening? There's an earthquake. So we need to know that. Liver or kidney complaints?
Nope.
Okay. Diet?
Was okay. Yeah.
Normal? Not vegetarian, vegan?
No.
Okay. Why is diet important? Yeah, for her. Do you know, there's a theory as to why we were able to grow a brain the size that it is. Because the problem about a brain is, even though it's tiny, it only weighs about 3 pounds, it uses at least 20% of your energy. So a lot of animals would struggle to get enough energy to fuel their brain. So if you're a chimpanzee and you're eating mostly leaves and roots and stuff, you have to chew for 8.5 hours, right? So just imagine that we stopped at 1 o'clock and everybody went off for lunch, and I've got to sit here waiting for 8.5 hours while you're chewing. And even if you did chew for 8.5 hours, you wouldn't get enough fuel to keep your brain going, because it uses such a huge amount of fuel. So they reckon the reason we survived, Neanderthal man didn't, we survived, is one, we've got this bigger cerebellum, we've got the computer to drive the brain, but round about the time that us and Neanderthal man were becoming popular across Europe, fire was discovered, the use of fire. And what could we do with fire? Cook. And what does cooking do to food?
Makes it healthy. Well, you can actually use it
to
eat,
Yeah.
digest
Yeah.
bacteria.
So how long did you take to have your lunch?
20 minutes.
Yeah, I didn't get one. By the time I'd finished here, gone back to my room, packed because I'm leaving today, can't stay here any longer. No lunch.
Well, that's enough cakes.
I've got my wine over there, I'll be okay. No, they reckon cooking was the thing because you can soften food. I mean, imagine if I brought in here a leg of, I don't know, lamb, raw. Is it? Yeah, off you go. You know, it's going to take you ages, isn't it? Whereas if I cooked it nicely with a little bit of mint sauce, you know, and you could eat it very quickly. So fire, the use of fire and cooking allowed us to have get more energy from food and grow a bigger brain. My youngest daughter is trying to save the planet, and she's gone vegetarian. And I keep teasing her, saying, your brain's going to shrink because you're not getting enough nutrients, and before long you'll be going around going, da-da, da-da. So she won't. Let me come forward because I'm hard of hearing. I'm not really, I'm just looking for sympathy. Sorry?
I'd say, isn't there something to do with omega-3 depleting from the mother's brain, especially with boys
Yeah.
in nature?
Well, one of the things is that you need quite a bit of omega-3, and it's difficult to get it from your diet. And if you take the American diet, which we're tending to imitate in Europe now, they've got a lot of omega-6, but not enough 3. And when I've been in America working, and I've tried to get what I call a real breakfast, I don't think a bucket of Coca-Cola and 12 donuts constitutes a decent breakfast. And so when I went for breakfast this morning, I was like a little child. They got sausages, and they got bacon, and black pudding, eggs. So when I go home, I said, oh no, I had the vegetarian option. Do you think I can lie and get away with it? Sorry. You are?
I just came from the US for this conference.
You did?
I did.
Welcome.
Thank you.
Where in America?
Maryland. Suburbs of Washington, D.C.
No, I've been to, sounds bad this, Florida, but I was in Ocala lecturing. Where else have I been? San Diego. I popped over into Mexico. Bad choice.
Oh, it's lovely there.
It is, but they said only stay with your guide. So I ignored that and wandered into the back streets. And there were all these thousands of children, obviously thinking tourists, rich. And so I had a load of shrapnel change in my hand, so I just lobbed it in the air and ran away. So, and where else have I been? Nashville, Philadelphia. So I've been to a few places, yeah. I got arrested going into America, so I don't like Americans now. Don't know why, it's because I had body parts in my luggage, apparently. Okay. But welcome.
Well, it's nice because I'm dual citizen. I'm U.S. British, so I can be whatever I want, whenever I want.
Yeah. I'm a dual nationality. I said this morning, French and Welsh, but I still hate the French. Okay. Right, so normal diet. Did you consume vast quantities of alcohol at the point you didn't know you were pregnant?
Just being on a skiing holiday camp.
Yeah.
Yes, probably. Probably.
No. The reason I'm asking, obviously, is fetal alcohol syndrome, which you all know about. But you do have to drink a serious amount of alcohol, I should know, in order to damage yourself or the baby. But it is a serious problem because the baby gets whatever you get. So, that's good.
But I think we're talking.
I'm going to put no. Okay. As long as you give me a tip at the end of this, 5 or 10. Okay. Were you taking any medication during the pregnancy? Okay.
Thyroxine.
Okay. So apart from medicine you get from the doctor, you also have to ask about stuff you can get across the counter, recreational stuff. I'm not going to embarrass you and ask you about the marijuana, but thanks for the joint you gave me last night. Okay. Did you take folic acid?
I did.
Okay. So as I said, that is meant to reduce the chances of you having a child with problems. Did you have an excessive intake of coffee, tea, chocolate?
Coffee and tea, no. I can't really recall about chocolate because I don't think I would have stopped taking chocolate, but I did switch to decaf tea because I also couldn't stand the smell of coffee.
Okay. That again is because they're stimulants. I remember when I was a student, I used to work late into the night. So I'd study until maybe 2 o'clock in the morning. And then I'd still be up early in the morning to study as well. You can tell I'm a nerd, can't you? So anyhow, my flatmate, Stephen, he decided, he said, I know how you do it. He said, every time you have a coffee, I'm going to have a coffee. And by the afternoon, he collapsed with tachycardia. And he said, I'm going to die, I'm going to die. I don't care if I fail my exams. And he gave up the coffee. So you don't want to be taking too much coffee if you're having a baby. Did either of you smoke?
Nope.
Why is that important? Why could smoking affect the baby? Yeah, how? Yeah, why? Perfect. Stand up and say that louder. You're a star.
Smoking narrows the blood vessels and restricts blood flow to the fetus.
Ta-da! Thank you. What was your name? Viv. Yes. I love you. Thank you.
Isn't it also a food suppressant as well, so the mother perhaps is not eating as
Absolutely, yeah. And you're getting loads of nasty chemicals into your body. So there are lots of reasons not to smoke anyhow, but certainly not. What? This one is trouble, you know. I don't know if you were in here earlier, but I was saying they gave me very kindly gave me a couple of bottles of wine. And I thought, it's a good, I was meant to be flying home tomorrow, but the flight was cancelled coming up, and I'm not going to risk it going back because I had to stay in the airport for hours trying to get a taxi up here. So I was saying I've got these 2 bottles of wine to take back on the aeroplane if I was going on the aeroplane. And her suggestion was that I could put them down my trousers, right? And she said, you can get bras as well that you can put things in.
It was for festivals. I don't know.
Well, we're not we were talking about how I get home. And you should imagine sort of going through the airport like this, you know. I think I might be noticed. Oh, dear. There's always one. I might have to move her to the back of the room. Okay. Do either of you and hubby, have any severe allergies?
He has hay fever,
Okay, that's not too bad.
and we can't have a dog because he's allergic to dog smell.
Get rid of him.
I know. I've got a cat.
Yeah, dump him, get a dog.
Yeah, I know.
Yeah. Yeah. My little dog, I said this morning, my little dog's poorly. And so part of me going home tonight by car as opposed to flying tomorrow if they had an aeroplane is that tomorrow I can be with my little dog because I'll get a day off because I'm not working tomorrow and I can be with her. It's a one-sided relationship. I love the dog. And the dog thinks, he's stupid, he'll feed me, he'll walk me, he'll brush me. But then if my daughter turns up, bye, gone. Doesn't want to know me. Unrequited love. Okay. Now, the thing about severe allergies is often it's a thing that will pass down through the family. So you have people, families that have hay fever, nut allergies and all this sort of thing. So you need to know about that. At the point of time you didn't know for certain you were pregnant, did you have an X-ray?
No.
No. Again, there is a slight risk of radiation. Okay. Once you did know you were pregnant, how many ultrasound scans?
The one at 7 weeks, the one at 12 weeks, then I had one at 20 weeks, and I probably had one every 2 weeks after about 24 weeks.
Okay. Okay. In the UK, how many is considered? Yeah, 12 and 20 weeks will be the normal for the UK. If you're in America, as soon as you say, I think I might be pregnant, they'll scan you every 5 minutes. And it's the same when I work around the world, because the first time they say, 20, maybe 30. You think, what? But it's what's the natural number for that particular country. So why did you have so many?
Because of my thyroid.
Okay. So how many would you say altogether? Just give me a number, rough number.
About 7 or 8.
Okay. So we need to know that, because sometimes mums sort of make it out everything's fine, and then all of a sudden, I had one done at 7 weeks and another one here, and you think, why? Is it because some ladies want to have 3D pictures taken, just because they want the pictures? Sometimes it's because whoever's monitoring the pregnancy is concerned about fetal growth. So you need to know why there are more than the standard 2. Okay. Did you think it would be this intrusive? Okay. Okay. No. But the interesting thing is, I'm not aware of any studies into how safe is ultrasound. Because the guy who invented X-rays, Röntgen, while he was building the machine to do it, he used to get his wife to come in so he'd sort of say to his wife, right, stick your hand in here, see if this machine works. Okay, and then he'd come back later, let's take another one. And she got radiation burns from the X-rays because they had no idea it was dangerous. And so people used to say, it's fine, you can have an X-ray. But nowadays, very, very controlled, because people realise that the radiation does irradiation, which damages you. Okay. There's meant to be a tea break this afternoon. Does anybody know when it is?
3:15, in half an hour.
Is it? Okay. Will there be coffee and biscuits?
Yes.
Yeah. And cake?
Yeah.
Okay.
Yeah, Mars bars.
Yeah, these PTUK people are posh, aren't they? After cake. Okay. How many weeks did the pregnancy last?
I was 9 days over.
Okay. How long should a pregnancy last?
42, isn't it?
Wrong. 38 weeks and 5 days. There's an amazing woman. Women do amazing stuff in research. There's an amazing woman. She teaches midwifery and she does research. So she got married couples. I say that so you don't realise, don't think anything naughty is going on. She got married couples and they had to keep doing urine tests because they wanted to pinpoint when conception took place. And she then was able to say that if you're within the normal age range, you will have a 38-week and 5-day pregnancy. So from the moment of doing it to the moment to give birth, 38 weeks, 5 days.
What is the normal age range?
Do I look like I want to die? No, because people talk about elderly mothers in their 30s. Yeah, I'm trying to be polite. I value my life. It varies again from country to country as to when there's the cut-off point. But I mean, you can have a woman in her 40s, incredibly fit and healthy, and but I mean, if you get up towards the 50s, then people start to worry because things like Down syndrome and what have you the numbers start to rise. But I wouldn't dare say elderly mother. I'm not that brave.
Were they used as worse?
Yeah.
My friend and geriatric mother was 30 weeks.
Yeah.
Yeah, 6 along in
Yeah.
he was quite young. Yeah. I know.
Well, he was in the UK?
Yeah.
Yeah. I mentioned my father was French, and I always remember him saying, I don't know if I was meant to hear this, but I remember him saying when I was younger, you're as old as the woman you're feeling. Well, he had a very strong, thick French accent. And so when he spoke, people thought, well, his English isn't very good. So when he made a mistake like that, they thought, oh, poor chap, doesn't speak very good English. Okay, did you have gas and air, pethidine, epidural?
I had gas and air.
Okay. When I worked in Latvia was occupied by the Russians. And I said to the first mother that I was doing the consultation with, did you have gas and air, pethidine? Nothing. I think, okay. So they try to avoid having anything at all.
I also had symphysis pubis dysfunction from 32 weeks.
Okay. All right. So how does that work then? You see, the thing is that we should be born at 22 months. Okay? Now, of all the ladies in the room, imagine that you're 25 years old. How many of you are going to have a baby if it's going to take you 22 months to have it? Can't see any hands up. No? Well, apart from the fact that you wouldn't be able to feed a baby that big, you just couldn't do it, and you wouldn't be able to walk around because the baby would be too big. You wouldn't be able to give birth. And this is one of the problems when Neanderthals and Homo sapiens used to get together, because you may sort of think, my boyfriend's enormous, he's great, you know, Neanderthal man. But when you came to have birth, how do you get this 14-pound baby out? And so you have a problem with the actual birth canal and the bones that surround it and the size of the baby. Now, the skull can run over itself and can literally get smaller. The pelvis can expand because the symphysis pubis can open, and the sacroiliac joints at the back can move. So you can make the actual birth canal bigger, but there comes a point where you get to absolute cephalic pelvic disproportion. So we can't be born at 22 months because we'd just be too big to get out. So what we do is we give birth prematurely so that the baby stands a chance of being able to get through the birth canal, but a lot of them get stuck, and you end up with an emergency C-section. So I digress, but I thought I'd mention that in passing. So any problems with the pelvis, we have to note. Sorry?
Does that influence as well, being C-section or a natural birth?
Yeah. Well, what they do is they monitor the baby, and if they think that you're a very petite mother, you know, some time ago, I ordered a pelvis, a female pelvis, from a company in America, and they sent it to me, and I thought, stupid people, they've sent me a child's pelvis. It was tiny. Huh? So I contacted them and said, you've sent me the wrong pelvis. I wanted an adult female pelvis. They said, it is, but it's Asian. I said, Asian? I said, it's tiny, literally tiny. So then they sent me an Afro-American pelvis, and I thought, this is lovely. But I've got little skulls. That's why I got arrested in America, because I had all these skulls. I had this fetal skull, which is birth size, and it wouldn't go through the Asian pelvis, and it only just goes through the African American pelvis. And so we take it right to the limit in terms of size of the baby and the ability to get out. If I was you ladies, I mean, if I was a lady, I'd have a zip fitted. That's what I'd do. I wouldn't go through all that business of, you know.
But for the baby's development, does a C-section interfere with their natural development?
One is the stressor, obviously, because the mum gets stressed, the baby does, because what was it, Caesar's thing? Ripped untimely from the womb. Wasn't that from Shakespeare? But also, when you're going down through the birth canal, you pick up bacteria from your mum. So you should be in a sterile environment, and then when you're coming out, you pick up bacteria. Then mum cuddles you, and you get even more bacteria, and then she breastfeeds you, you get more bacteria, and you get food for the bacteria to build up your microbiome. So you need bacteria. Now, people think bacteria are bad. Ugh, you know, one of the things with people with OCD is, you know, they keep washing their hands and whatever because they don't want all these bacteria. But the vast majority of bacteria are harmless or good for you. And so one of the things about the C-section is that, you know, if you imagine, sorry about this, if you're an American mum and you have a designer birth, I'm going to give birth next Tuesday because it's my birthday 2 days later, you know, all this sort of stuff.
They offered that to me.
Huh?
They offered that to me.
Yeah. So you can have birth whenever you want. You do it on Tuesday or Friday, whatever. C-section, you're not going to breastfeed because you want to get your figure back as quickly as possible and design a birth. But you're depriving the baby of what it needs. Same thing with cutting the cord. Historically, baby pops out, clamp, cut, hand baby to mummy, right? Well, all the blood stock that's in the placenta needs to come down to the baby, because if you clamp the umbilical cord immediately and cut it, all that blood stock stays in the placenta and it should be in the baby. And again, this lady who worked out how long pregnancy is, she was the one who says, don't cut the cord until it stops pulsating. Because, you know, it's like sort of me, you know, you're filling your car up and, you know, we've got half a tank of petrol, and I say, no, we've got to go now, and I drive off. Well, I'm going to miss out on the other half a tank full. So we need to have people like this lady, I can't remember her name, who keeps coming up with these wonderful ideas, instead of saying, put the wine down your trousers and wear a bra.
That is a wonderful idea if you need it.
I don't know who she is, but I'm beginning to think she's a drug runner. She's one of those mules. There's always one, you know, when you go to a conference, there's always one. Okay, so this was a normal unassisted delivery?
Yes, they had to break my waters,
Okay.
and then I was put on Citizen.
Huh?
And I was given a drip.
Ah, so induced as well.
No, I don't think I was. I think what had happened, I'd gone quite quickly to 6.5 centimetres or 10 centimetres, but my waters hadn't broken, so they broke me with a crochet hook.
Yeah.
And then stuck a drip in me. And then it just kind of, then I just managed to do it on my own.
Okay, good. So Fred was born in hospital.
He was.
Okay. And once you thought, hello, I'm having a baby, how long was the labour?
Probably about 8 hours.
Okay. It varies considerably. It depends on the size of the mother, the age of the mother, and all the rest of it. If you have a sort of, 4 to 6 hours is okay. What you've got to bear in mind is that nature has decided baby's coming, And what you don't want is baby hanging around for 10 hours, 12 hours, because the baby's going to get stressed. And so we talk about fetal distress, and we talk about primary, secondary. So if you get stuck in the birth canal, you know, and this thing is squashing you down and pushing you, and you think, well, I can't go anywhere, I'm trying, I can't go, right? So there's that, there's primary fetal distress, all the cords around the neck. So every time you get pushed down, you're being strangled, throttled, right? So that's a problem. And then there's secondary fetal distress when other people get involved and start trying to manhandle you out, or use suction to pull you out, or forceps to pull you out, and whatever. And you can get all these dystocias, damage in being born. So it may be that you get damaged because you're trying to get through a very narrow canal and you're not rotating as you should do, or somebody comes in and they're trying to pull you out. Now just imagine if I said to one of you, lie on the floor and I'm going to pull you across the room by your head, not your hair, by your head. You'd be thinking, no, you're not. Huh? I mean, it's interesting, when I, again, worked in Algeria, I was asking about ventouse deliveries, forceps. They said, illegal, can't do it. I said, what do you mean? They said, ventouse. And the thing with ventouse is it can pull the scalp away from the skull. So you can get a bleed, a subgaleal hematoma here, or the blood vessels that go through the skull into the inside of the cranium, they can be ripped, so you can have a bleed inside. So you sort of think, you know, I'm in the interior of Algeria in a place called Biskra on the fringe of the Sahara. You know, they're going to be really primitive here. No, too dangerous, we're not going to do it. It's amazing.
So can I just say, so my son had a cord around his neck. And I didn't,
Hang on, I'm going to have to come over there and,
so my son had the cord around his neck. And
Yeah.
I didn't pick up on it, and they kept telling me to push, and they induced me to.
yeah.
And eventually, a locum comes in and says, this baby's distressed, can't you see? And what he did is he got me to do yoga breaths and move my muscles, so there was almost no suctioning whatsoever. It was just him telling me to open, contract, breathe. And they said they'd never seen anything like it, and he just managed to more or less just unwrap the cord, talking to me through the muscles.
Brilliant. Yeah.
To deliver him.
Yeah.
And I think there's a lot of lack of understanding of what can be done with that kind of communication about the anatomy.
Yeah.
Because it's...
You know, the thing is that we, as humans, what we tend to do is that we've done something so many times and it's always been okay, that we just assume that this is okay. And it's easy to miss. Yeah. It's nice back here, isn't it? You okay, Fred? Okay. Right. The placenta, normal as far as you know?
I think so. He pooed on the way out as well.
Uh-oh.
It was disgusting. They had to take him away and wipe him off before they gave him.
Fred, aren't you ashamed of yourself? You disgrace yourself before you've even been born. Okay, what do you call baby poo?
Meconium.
Okay, and is meconium good or not?
It's good, isn't it?
Eh?
Isn't it good? Not as bad. I don't know.
No, I mean, basically, if you inhale it, it's a medical emergency.
Yeah.
So you don't want a baby in the birth canal surrounded by meconium. Fred. Okay, so fetal distress, the presence of meconium flags up as a stressor. Okay. So, was anybody concerned about the baby during the labour delivery?
No, not
So
that.
the fetal heart rate didn't
Yeah.
fluctuate? No. I'm still going to put yes for fetal distress, because if there's meconium, there is a potential for a problem. Excuse me, a problem. What was the birth weight?
£7, 3 ounces.
Okay. Okay. Can you remember the APGAR score? No? Who knows what the APGAR score is? Basically, there was a lady.
4.5 rings.
Eh?
It's 4.5, mate? No.
No, not good. No, it's a score. It's a score out of 10.
Oh, okay.
So 10 is perfect. There was a lady called Mrs. Apgar, and she came up with this idea of doing a test on the baby a minute, 5 minutes, and 10 minutes after birth. So appearance, you look at the baby, is the baby okay, the right colour? Pulse, grimace, you pinch the baby and see if they grimace. So you do these tests on the baby to see if they're reacting as you should be. So if you're 0 to 1, the baby's near to death. If they're 8, 9, 10, fine, then the numbers should go up. But it's a way of just looking at the baby and rating initially, immediately on birth, how's the baby doing? So you can't remember. Were they running around like lunatics?
No.
No. So probably okay. All right. Breast or bottle fed?
Breast.
And for how long?
16 weeks.
Okay. And did the baby struggle to latch on at all?
Not really. He just wouldn't get off. Yeah, he'd just latch on and then just fall asleep.
Okay.
And then just wouldn't stop.
Okay. One of the things you have to ask about is, was the baby breastfed? And if they say yes, no, whatever, if they say no, you say, why not? It may just be your choice. I don't want to do it. That's okay. Right? You're depriving the baby of a lot of things, but, if you may not have enough milk. There's all sorts of reasons. If you try it and the baby can't latch on, that's important because we use our cheeks, we use our lips, our tongue, our throat to feed. And you have to latch onto this thing. And basically, if you can't do it, we sort of mark that up because often the babies who can't latch on are late with their speech development. So there's a sort of, a link between the two things. He latched on without a problem. You were producing ample milk, yeah?
He was also taken to, he was put in an incubator after about 24 hours because they discovered he had jaundice.
Okay.
So he was in a bully blanket for about 24 hours.
Yeah. Okay. So that's another indication that there may be fetal distress. So nothing to worry about now, though. Okay, when did you introduce solids?
4 months.
Okay. It's quite interesting that in the UK, historically, there was a north-south divide. So you'd ask somebody, when did you start feeding? They say 4 months. You ask somebody else, say 6 months. In Scotland, they give them haggis from day one. Yeah. Here's a wee drum. That'll do you. Yeah, okay. Did your child suffer with colic?
No.
Okay. Persistent vomiting, reflux? No. Any bowel problems as a tiddler?
No, not as a baby.
No. Okay. You probably know this, but there's lots and lots of research. There's a lot of people looking at gut health and function and the development of the brain. So you want to know right from the start about breastfeeding, bottle feeding, taking milk, allergies, and all the rest of it, and how they then cope with eating food. So we need to know all those basic factors to get an idea of how the baby's doing bodily wise, but also in terms of their brain development. Okay? When was your child sitting unaided, completely unaided, not propped up, just on their own?
Probably, I would say, about 5.5, 6 months.
Okay. Normal?
6 months.
Yeah. 6 months is what you consider to be normal. Did your child crawl on their hands and knees?
Yep.
Okay. Why is that important? Oh, hang on, stop. There's a man talking. Be quiet.
I was going to say motor development, and it's important to like stretch the tendons in their arms and stuff.
Yeah, good. No. Oh, that was quite a shock to me. A male voice. Hey, I've just got to speak to Rochelle. I didn't see you. You snuck in.
I was hiding away from you.
Hello, darling. I always, when I do the main sort of lectures, I always pick on someone in the front row. So she was my sort of butt this morning. Yes, what the gentleman was saying, it's about motor development. So I mentioned this morning about handedness, and handedness is decided not by the brain, not by the mother, it's the spinal cord. Because long before our brain is connected to our arm, babies suck their thumbs. And when you go and have your scans, oh, look, he's sucking his thumb, right? Well, how did he get his thumb in his mouth? The brain's not connected to this, but the spinal cord is. So in your spinal cord, in the neck bit and in the low back bit, you've got what are called central pattern generators. And central pattern generators sound very posh, but they're tiny, tiny little neurons. They're called interneurons. And you've got thousands of them, thousands in these central pattern generators, and they learn patterns of movement because all the movements we do are made up of smaller movements. So if I want to play tennis, I've got to be able to grip, I've got to be able to move my wrist, move my elbow, move my shoulder, and move my body. So if I put those movements together and practice, I should be able to play tennis. I mean, I do it like that, but people at Wimbledon do it like that. So in order to get that thumb into my mouth, I've got to be able to do that, make a fist, move that, and my central pattern generators can put those movements together. Sorry? Yep.
I'm wondering if, like, babies already, the finger is in the, when it's in the womb,
Yeah.
fetus, if the finger already is in their mouth when the cell is dividing time, rather than later starting to suck their thumb in the
No, because at the stage we're talking about, you're pretty well formed. Because when you're starting off, we go through sort of stages of development. So you start off, a bit like a reptile, then a bit like a pig, and then you get to be a human. So it's after that stage. So the baby looks like a baby when they're actually doing it.
Thank you.
Where's your accent come from?
I'm from Turkey.
Where?
Turkey.
Turkey. My wife keeps going to Turkey because you can buy handbags there. Really cheap.
Yeah, I know.
Yeah, she tells me that these factories she goes to is where they make Gucci and Chanel handbags, right? And then they ship them to London and they sell them for thousands of pounds, and then you can buy them locally for 70 quid. So she goes out there with a suitcase and comes back with about 12. She's got a bottle of wine down each trouser leg. She's got a false bra on, and she's got about 70 handbags. Yeah.
Is that thumb-sucking reflex in preparation for breastfeeding? Is that where that comes from?
Yeah.
Good, yeah. It's interesting that as we go through our stages of development, who knows about primitive reflexes? Lots of people know about primitive reflexes. Now, if you get a baby, I'll go to the front so everybody can see because I got told off for this earlier. If you get a baby and do this to the bottom of their foot, their toes spread. Once they become a toddler, you do that, their toes go down. So that primitive reflex has been suppressed. So we go through these things. And so lots of the things that happen at stages. And if they don't happen, then you note it. Now, I have to say this, that primitive reflexes never, ever disappear. Never. So you could pay a fortune, go to a therapist and have brushing or do exercises, angel in the snow and all this stuff. And you think, oh, wonderful, all those primitive reflexes have gone. And if I make you jump, they'll all come back again. So you spend hundreds of pounds to get rid of these primitive reflexes, and I go, boo, and they're back.
So I have another question about that.
Oh, sorry,
You were talking
I'll
about
cure you later.
You were talking about ticks
Yeah,
early on, and statistically, proportionally, a huge number of teenage females have developed ticks during the lockdown.
Yeah.
Did you know about that? Yeah. So I'm curious about that in terms of the primitive reflex and it being females and it being locked down.
basically it's right brain activity. It's the bit of the brain called the anterior cingulate, and tics come from there. So if it's facial tics, that's almost certainly where it's coming from, and it's to do with anxiety, because the bit that's next to it is the bit of the brain that deals with emotions. And I'm not being male chauvinistic, but women are more likely to get scared of something than a big macho man like myself. I'm sorry, I've been silly. But no, I mean, if you think about it, if you were walking down a dark country lane and you thought, oh my God, there's a man coming towards me, it's a bogeyman, he's going to get me, you're more likely, and should do, because you're more likely to be attacked than I am. You know, because I'm ugly and hairy and whatever, and you're beautiful, right? So you're programmed to be more defensive. So one of the things that females do is this. Right?
It's what,
Sorry. Is we do, ladies do this. And that sign means I won't hurt you, I submit. And if you're telling a child off, they'll do that. And that movement says, I submit. You're baring your neck, which makes you vulnerable. And if you have a dog that's, my eldest daughter used to have 2 fully grown Rottweilers. And I took my tiny little puppy over, a Bichon, and the female Rottweiler would come up, lick her, and then attack her and pin her to the ground. And my dog just instantly did that. And it's the same thing in the doggy world to say, I submit, I'm no threat to you. And the Rottweiler would then give her another kiss and just walk off. It's just saying, I'm the boss. So eye contact, weird thing, really strange. There's a whole language of what we do with our face. But these tics coming from the right side of the brain, the emotional side, the defensive side, and it's just struggling and it's producing signs that shouldn't be there. But it's a lot of television presenters, when they do a piece to camera, because they're hyper-conscious of the fact that the camera's looking at them, little tics come out. The guy who used to do Who Wants to Be a Millionaire, when he was sat on his stool talking to the person, he was great, fine. But as soon as he had to do a piece to camera, he took a particular posture and you'd see a little movement going like that. And it's just a little tic coming out because he was in the limelight. The camera was right on him. It's gone 3:15. I've talked too much. Go and have tea, coffee, biscuits, and cake. Okay. Right. I've just it stopped raining, by the way. I only went out there to check if it was raining. So the thing that people have been saying, he goes out there to smoke, it's not true. I only go to check the weather. Okay. We've got an hour and 10 minutes left, so we're on page 3. So there's a picture of a topless woman on here. Do you remember the sun? Yeah, page 3. And we've got to get through to page 10, so it's highly unlikely to happen. So I keep saying to people, you need to invite me back, but I need to talk for about 3 days. And I mean me talk for 3 days, not other people talking for 3 days. Because there's so much to say that I can't say because it sounds like, you've got a 3-hour slot, but that slot goes down to 2.5 hours, an hour. They get cut back because you need to have tea breaks, pee breaks, and all the rest of it. So ideally, I need to come back and spend more time with you. Sir?
Just ask, with the assessment, how long would it usually take to do?
Oh, a lady just asked me that. I set aside 3 hours. Yeah.
We, at the place that I work, it's a clinic that our triage form is basically lots of these questions because they triage for is it play therapy, OT, language, and it's like a 30-page form, but it gets a lot of that information done that you can then pick up in the parent consultation.
Because I do 3 hours. It's split between, it depends. I can do just the mother on her own or the mother and the child. So if it's just the mother on her own, because she wants to talk, she doesn't want to talk in front of the child, she feels he might get upset or whatever, fine. And then I do mother and child together, because the child can answer questions the mother can't. Like, what can I think of? Do you suffer from headaches? Do you hear noises in your ears when there isn't a noise? Maybe you're looking for tinnitus or whatever. Only the child can answer. So I have to do either mother and child or mother and child, then the examination. But then I do another 2-hour session 8 weeks later to do a reassessment to find out how well they've put the treatment in place, but also to check that my initial results were accurate. So it's a 5-hour assessment in fact. So you can't do it. This lady says, in America, it has to be like 15 minutes.
50.
Yeah. So, it can't be done. There's too much information.
How do you charge for that?
Sorry?
How do you charge for that? Do you charge hourly or do you charge
Or the whole assessment?
Fixed rate, yeah.
fixed rate assessment?
Yeah.
So per hour.
Yeah. I always feel guilty about it, but then when I hear how much they charge in the private sector, I think I'm charging peanuts.
Yeah.
Yeah.
Are you willing to share how much or not?
Yeah. 300 for the initial assessment, 200 for the second assessment, 100 thereafter.
Okay, yeah.
So my eldest son went to have a checkup at a private hospital for, I think it was a hearing thing. And he's very money conscious, and he was in with the so-called consultant, who wasn't a consultant, for 22 minutes and paid £275.
Yeah.
And when he went out and they said, right, you need to pay now, they said, did he use anything? And he said, what do you mean? Well, if he used any swabs or whatever, that's charged extra.
Yeah. I saw a thing go around recently on Reddit or whatever, and it was a picture of a bill from a doctor's, and the person, it was in America, and the person who had sort of put the bill on said they charged me $40 for emotional support because I cried during the assessment or something. So she went to the doctors to speak to them, cried during the meeting with the doctor, and then they charged an emotional assessment during it.
Well, the thing is, if I was, say, a solicitor, I could charge for you calling me.
Yeah.
Right?
It's like a taxi.
You say, can you write me a letter? I charge you for that. And solicitors have people to actually create the bills. Because, you did this, you wrote 3 letters, you had 6 telephone calls, blah, blah, blah. But people will contact me and say, can you write a report? And I say, yeah, I can. What do you want it for? Oh, I can do that report for so much. I said, oh, I wasn't expected to pay. Well, who's going to write the report?
And that takes time.
Yeah.
Obviously. Yeah.
So if I've got to sit and write an individual report, who's going to pay for it? But people just assume, but I feel like saying, well, if you go, to wherever you go to shop and you go back there again, do you say, oh, I paid last time? Yeah?
Do you think that's something to do as well with like people, if you go to sort of like a private doctor about something like about like your physical health, people are more willing to pay more, and it's sort of like about raising the profile of mental health to like sort of like give credibility to people to be able to charge more, because I found sort of going into sort of play therapy, there has been a question around like pricing and like how much do you charge and stuff, and a lot of people do, I think, undercharge, and it sort of diminishes the meaningfulness of it, because people sort of say,
One of the problems is if you've got a health service that you feel is free, which of course it isn't because you have to pay for it indirectly, you think, well, why should I pay him, when I don't have to pay him? Well, no. But the people who go into the private sector know that if you're going to have an operation, it's going to be £6,000, £9,000, £15,000. And you think, well, how long did he spend doing it? I had an operation on my leg, and I was conscious through the whole thing, which was brilliant because I could talk to the guy who was doing it. And he said, I'm just going to put this stent in now. He said, this is 1,500 quid to put this stent in. This is just a piece of 4-inch metal. Very nice metal, but metal. And he was chatting to one of the theatre sisters, and he said, how much anaesthetic have we got left? She said, we've got 20. He said, I'll give it to him. I said, I'm not a private patient. You're not going to bump the bill up, are you?
Down his trousers.
I've got a supplier now, so I'm okay. Okay. Right, so the last question I asked you was sitting unaided.
Yep.
Next question, did your child crawl on their hands and knees?
Yes.
Okay, now that's important for establishing these central pattern generators. That's movement that originates in the spinal cord. And one of the things that's difficult for a man to put up with is you're in the swimming pool and you've got these women going up and down like this, right? Non-stop. And they're talking non-stop. And I'm sort of trying to swim one length of the pool and they just going like that all day and talking. Central pattern generators, because once you plan a movement, rather than having to do it again and again and again, you send a message from the brain down to your brain stem, and there's a nucleus called the pedunculopontine nucleus, and it just tells the central pattern generators, do that, do that, do that. And that's why these annoying ladies can talk and swim at the same time. Clever, isn't it?
Do you have muscle memory with that?
Huh?
Do you have some sort of muscle memory with that?
Well, yeah. I mean, basically, the central pattern generators know which muscles need to move, so they just send the messages down to the motor neurons rather than you having to program it here. So when you get to the end of the pool, you've got to turn round, you use your brain. But as soon as you do the first stroke, then it's the spinal cord that's doing it, not your brain. Okay. Right. When was your little man walking unaided?
Unaided, I would say 14 months.
Okay. Okay, so far we've got possible fetal distress. We've got everything else is normal, so sitting unaided, crawling, walking. It's better to walk a little bit late, because normal is about 12 months. But a bit late is far, far better than early. So if you were sitting there saying, sat at 4 months, didn't crawl, walking at 9 months, I'd be going, uh-oh. And then I'm going to ask about speech, and then you would say, chatting away by 14 months, full sentences, then I would really worry, because if you've got an Aspergic history, That's what I would expect to see at this stage. So already I'm formulating, certain ideas in my head as to where we're going with this child, where there's likely to be problems.
So interesting, because a lot of parents are really, usually a lot of parents, are really happy that their child is developing. It's like sometimes there's a competition.
Yeah, yeah.
So
So it's quite difficult for me to sort of, because
And you start,
yeah. Okay. Towards the end of the first year, did your child, Fred, have single words, mama, dada, that sort of stuff?
I think so.
Yeah. In the second year, 2 words together, me come, you go. Bye-bye, daddy.
I think so.
Yeah. And by 3, many meaningful sentences, not necessarily grammatically correct.
Yeah.
Yeah. Okay. So your child's never needed speech therapy for any reason? Yeah.
Yeah.
Now that's an important question because so far all normal parameters, so you could assume no problems. But you still have to ask the question because if you assume, you may get things wrong. Why did your child need speech therapy?
In Wales, children go to school at 3 years old, so he went to nursery.
In Wales?
Yeah.
Oh, right, we're going to have to get another patient. In Wales?
Yeah. Get him in young.
You mean in nursery
No, school.
or reception?
School. Yeah, it's nursery and school. School uniform, the whole shebang. They don't make trousers. They don't make trousers that small, to be fair. Yeah,
I
so-
think I said to you, my mother was born in Wales, so when I was little, they checked my feet to make sure they weren't webbed. Only people from Wales would understand that.
Yeah. So it was picked up that he would confuse his pronouns.
Mm-hmm.
So it would be he for she and that kind of thing. He would struggle with in front of and behind and those kinds of things.
Mm.
And we had echolalia as well. He wouldn't answer if he was asked a question. He would repeat the question back to you.
Okay.
And to be fair, he still communicates like that. He will ask the question. He will ask you a question when he knows the answer.
Okay. Everybody know echolalia is? Yeah, good. Right, when was he dry by day, completely out of nappies?
He was 2 years, 10 months, I think, because we did it before he went to nursery school. But the problem was he would never actively seek to ask to go to the toilet. So he'd be dry, but then he wouldn't actually ask school staff, I need the toilet, can I go to the toilet? They'd
Okay.
have to ask him to go.
All right. And what about dry at night?
Probably about 3.5 to 4.
Okay. So as a rule, girls become continent before boys. And it's because us boys, we're obviously more complicated down there. So you've got 1 valve, we've got 2. Because we've got 1 valve the same as you for letting urine out. We've got another one because when we make love and ejaculate, you have to, like, points on a railway system, you have to change the points. So you're doing this for breeding, and then you're doing this for urination. So you have to be able to decide which is which, what's going on. So peeing is more complicated for boys, and we'll be talking about soiling in a minute. Bowel movements are really, really interesting because isn't it a weird thing to be talking about? Yeah. Just inside the anus, there's some special skin, special epithelium, and it's got nerves in it, nerve endings, and their job is to decide if the contents is gas, liquid, or solid. Now, it's a bit confusing, isn't it, when you're young, because you want to, pass wind, I'll put it politely, but is it wind? No? So you could get, make a mistake and get a follow through, or it's diarrhea and you're going to be standing in a brown puddle. So the brain has to decide what it is, and it often gets it wrong. So urination is complicated enough because the bladder has to tell the spinal cord, and there's a special little nucleus there, nucleus of Olaf. So it has to send a message, and then when we're little, it just sends a message back saying, okay, open the taps. Then at a certain point of development, when the message comes through, the little nucleus at the bottom of the spinal cord has to send a message to the brain stem. And in the brain stem, we've got Barrington's nucleus, and that has to send a message to the brain itself. I've got the brain ready for travel so it doesn't fall to bits. Okay, so inside the brain, just here, is the micturition center, the peeing center. And that's just above the anterior cingulate, which is part of the frontal hub we were talking about this morning. So this bit, or that bit, either or, can tell you the health of the other bit. So if this bit's under-functioning, this bit's likely to under-function. And this bit then has to send a message to the insular cortex in there so that you become consciously aware of, I need the loo. So peeing is fairly complicated because at night, the bit down here, Barrington's nucleus, can be shouting up at the micturition center, we need a pee, hello, we need a pee. And the micturition center's going, and eventually Barrington's nucleus says, oh, enough of this, and it just sends a message down, pee, and you wet the bed. So you can have problems with bladder control, but some kids have problems with poos. So they may have had a painful experience, so they don't want to do it, so that they hold their feces in, which makes them harden, because one of the functions of the colon, the rectum, is to take fluid out to get it back in the body. And so you get hardening of the fecal matter. So you can have problems like that, or the kid's frightened of the toilet. They want to poo, but the toilet's scary. So there's all sorts of reasons. Plus, the brain's got to work out, is it gas, is it liquid, is it solid? And it's easy to get it wrong. And lots of kids poo their pants because made an error. Or poor hygiene, they don't clean themselves very well, so they get skid marks in their pants, as every mother will know. So it's a complicated old business. Hang on, I've got to come back to you so I can hear you.
Don't they find that children on the ASD spectrum may have interoception issues about all those sensory feelings and then get into problems because they don't find out what their body needs to do?
Yeah.
So they end up with quite early bowel problems.
Yeah. Because you've got to interpret, because the thing is with the brain, we tend to think that it's working but the way it appears to be on the outside. But if you think about it, sound is vibrations of the air that go in your ear, move your eardrum, which moves 3 bones, which moves another thing, which makes some water move, which makes a hair move, which causes an electric impulse, which goes along a nerve, goes into your brain, and we interpret it as sound. Which is amazing, isn't it? But it's all just electrical activity. So with that knowledge, the old philosophical thing, if a tree fell down in a forest and there was nobody there, would it still make a noise? Well, what is noise? Yeah? And so if you follow it back from a knowledge of how the brain works, the tree does still make a noise. Well, it makes vibration. So, good point. Boom, boom. Oh, it's exciting. We're going to page 4. Okay. So once your child was out of nappies, any serious regressions?
No.
No. Why would I ask that question?
Because children regress when they're stressed.
Precisely. So if the child's been dry and all of a sudden they start wetting their pants, you want to know why. And also, if you start getting things like bedwetting, soiling, you really want to know why, because soiling then is one of the early signs that there is serious abuse going on. And so you want to know why that's happening. And if you see soiling and blood, you really, really want to know. So you need to, it's horrible because we don't want to think that, child abuse will happen, but it does. So you...
If the parent says, I don't know, it's like, oh yeah, they did, but, and you start probing and then they're just like, I don't know, it just happened.
Because I do a whole lecture on sort of how you deal with these situations, because if you've got a gut feeling, at some point, you've got to take it further. And so you may then want to, in my situation, I would speak to the school, the GP, people who are caring, to see if there's any other evidence that something might be happening. But, you can't leave it. Whenever it comes on the news, some little child's died or whatever, there's always, someone, they point the blame somewhere and say she should have taken it further. But it's so difficult, isn't it? Because would you want to say to a mum, is your husband or your lover or whatever interfering with the child? It's horrible. Yeah. I was watching a series, I'm trying to think what it was called. It's called Borgen. It's set in Denmark. And one of the main characters you learn as you get in towards series 2, there's 3 series, that he was abused as a child, and it's affected his character as a man. He has, horrible sort of relationships with women because he wants to be normal, but he can't be. So it's a really tricky subject to deal with.
Do you think that if the child is sort of trained to be dry from early on, that could be the reason why the child might regress?
Well, if they've been pushed into it, you mean? Yeah.
Because sometimes I find that some parents do it when they have a policy at nursery that they have to be dry.
Yeah, that's true. Yeah, some nurseries you have to be fully continent before they'll accept your child, and so mum then gets stressed because the kid's got to be dry and all the rest of it, and you can imagine sort of sellotaping them to the potty. You'll sit there until you do it. So yeah, and of course it's very easy to rebel, isn't it? I don't care, just pee yourself. Sorry, I've got to come forward again.
Science behind the potty training, is there any certain age that you can say minimum, you can start that age and then maximum?
It depends on how well the child is growing and developing. So, some people say, dry at 18 months. But as a general rule, girls 2, 2.5, boys a little bit later.
3.
Yeah.
Between 2 and a half.
Yeah.
I think cultural things also affecting on potty training as well.
Yeah. I mean, as you go around the world, you find different ways. I was talking to you earlier about cultural things in that in certain societies, children are accepted. So you go to a restaurant, whatever, and the child's running around and making a noise. Nobody bothers. The waiters will, play with the children and all the rest of it. But in other places, they're sort of looking at the children and say, shouldn't be in here. No, this isn't the place for children. And so it depends on the culture, in which you're immersed and in which they're growing up.
How do you factor culture into your questionnaires?
Easy answer is say experience. I just have to adapt what I'm doing to wherever I am. Yeah. No, because I worked in the Middle East for quite a while, and a case in point, there was a little boy of, I think he was under 5, and rich family, and the little boy had his own personal chauffeur. And he used to beat the chauffeur up because the chauffeur wouldn't stop at the sweet shop. Because dad had said, don't buy him sweets, or mum had said, don't buy him sweets. But the little boy wanted sweets, and so he used to beat the chauffeur. He used to beat the maids at 4. Right? But boys are allowed to do that because boys are obviously best, you know. Just make sure you didn't stab me. But in some cultures, you know, girls aren't important. You know, you look at places like China, the Middle East, wherever, you know, there's positions. That's what I was saying on about the bonobo, our closest living relative, matriarchal society, total peace. There's no recorded case of a bonobo killing another creature. Could we say that? No.
When do you look at parenting?
Yeah, I was saying to someone earlier, it's a big problem because I was citing a case at the moment. This little boy, he is disobedient, defiant, swears, and I mean proper swears, not real swear words. And if you look at the relationship of mum and dad, they're both professional people, and they both want to be better than their partner. They want to be earning more money, better position, more status, and all the rest of it. And the little boy gets ignored because, you know, I'm the boss round here. I'm the guy that's earning all the money. And no, my job is so important. You know, and all this stuff going on. And you think, well, what about this child? You know?
The child is a symptom, no?
Yeah. And let's face it, if I suddenly said a 4-letter word, I think I'd gain all your attention, wouldn't I?
Yeah.
And so he has learned that if you say the F word, everybody stops and looks around. And
Yeah.
so it's a really good tool, isn't it?
Yeah.
Yeah. Now, if the parents realise that, but are they? Because I still want to get that promotion. I still want to be better than you. Huh? Yeah. And so if while this battle's going on, the poor little chap gets ignored. I had to do a report recently, and I described the little boy as a lovable rogue. And that's what he is. He's adorable. Yeah. Okay. Right, so out of nappies, no problems. Any aspects of soiling?
No, constipation.
Okay. And we won't have a chance to get to it now. How would you describe diet?
When he was baby, he decided to be sick at one point after eating something red, and then would never eat anything red after that. So everything was beige. Anything to do with cheese and ham, would eat sausages, very, very limited diet, wouldn't eat fruit and vegetables. From that point on, very, very restrictive. So quiche.
Okay.
So
Yeah.
not a very, very healthy diet, I would say.
No, it's quite tricky because some fruits in particular, vegetables, but fruits in particular, contain chemicals which can cause us some minor irritations. So some boys can't eat oranges. The chemical in the skin of an orange causes an irritation inside the urethra. So it's like having an infection, and they pee themselves as a consequence. So I can understand why that would happen. And let's face it, you know, if something's going to make you ill, feel sick or whatever, in here you're going to think, I don't know, I don't want to do that. Now in the brainstem, you've got a thing, again in this little belly bit here in the pons, you've got the area postrema, and one of its functions is to stop you eating poison. Now, it will kick in, and then you'll start retching and then vomiting, because the whole thing is you want to get rid of something that's likely to poison you. Well, if in here, subconsciously, you're thinking red stuff is bad, As soon as you put it in your mouth, this bit's going to kick off, and you're going to be sick. Yeah? So we don't realize how our brain controls what we do. There's an incredible video I watched once. It's filmed in Africa, and there's some large animal, water buffalo or something, that's died. And we say the water buffalo is back over there where that pillar is. And this guy's walking towards this dead water buffalo. It's lying on its side and it's all bloated because it's full of gas, right? And he's walking towards it. He said, I can't get any closer, he said, because I'm going to be sick, right? There's a stench from this dead animal in the sun, Africa, right? So they move back away from the stench, and then this whole pack of hyena move in and eat it, right? Now, hyena, they have a digestive system that won't react to the bacteria that are, in this dead animal, whereas we would die if we ate it. So what does our brain do? Don't eat it. So as you go towards the smell, you go, and you're actually sick. Whereas the hyenas are going, lovely, delicious, I want more, right? So our brain protects us in many ways. So what we have to do in a situation like this is work a way around it so that the brain actually thinks, actually, this is okay. Not easy, but it is doable. Sorry.
At the same time, we're slowly killing our kids with chemicals of all sorts of things
Yeah.
that are really negatively impacting on everything.
I'll give you a very simple example. Everybody's heard of E-numbers, yeah? Everybody knows. 2,500 plus chemicals that you can legally add to food. Now, when they came about, E-numbers, European numbers, they tested all the substances individually, right? And they said, right, this is E1, it's safe. This is E2, it's safe. This is E3, it's safe. And then a few years back, Southampton University thought, what happens if you mix these things together? Because when you buy a food and you're reading the label, it doesn't contain just one E number. There'll be several. Yeah? So what they did was they got colorants, because colorants are used in lots of children's food, and they got that wonderful substance called aspartame. Now, aspartame, the artificial sweetener, if you look at its history, and it's documented in America, it's been vilified, it's been justified, it's been vilified. If you read all the research papers, all the ones that were paid for by aspartame, the manufacturers of aspartame, safe. If you read the independent reports, it's lethal, right? So what they did was they mixed colorants and aspartame together. It's a neurotoxin. It's a brain poison. Now, a few years ago, somebody here is going to be intelligent and they're going to tell me, the first Harry Potter film, remember that when that came out? I can't remember what it's called. My wife bought tickets and we went as a family to Bournemouth and we went to this lovely cinema. I went off to collect the tickets that we'd bought online and the kids went off to buy popcorn and stuff, right? So we're in the cinema, long film. My son is eating popcorn and I'm having the odd handful. My daughter has got a huge bag of Haribo sweets. And when we get out, she's eaten this whole bag of Haribo sweets, right? We get in the car, we're halfway home, and she goes totally off her head. Now, she's a perfectly normal, everyday child, never had a problem with her, okay? She's trying to kick the windows out of the car. She's completely off her head. It took us probably 4 hours to bring her down, and she wasn't normal for 3 days. Now, what caused it? Do you think it might have been that big bag of Haribo? Yeah? Huh? Now, the manufacturers will say, no, she obviously had some psychotic event or whatever. No. Poison. Yeah. I think there's 127 common side effects of taking aspartame. The most, you get tiny ones, like it can make your eyes sore, or you can die. And it's documented. Only if you read the independent research, not the research that's been paid for by companies.
It's also in a lot of diet foods, isn't it? And sugar-free foods.
Yeah.
Actually,
Yeah.
it's so
And one of the things you have to realise is the manufacturers will lie to you or bend the truth. So if it says no added sugar, how much sugar was there in the first place? And if there's no added sugar, why is it so sweet? Huh? If it's
the body doesn't recognise it.
if you're buying yogurt, right? I want to buy a strawberry yogurt. Do I buy the strawberry flavour or the strawberry flavoured? Which one do I buy? Do either of them contain strawberries? Right? Now, you're, an everyday human being doing a shopping. All you want is a strawberry yogurt. But how do you know that you're going to get yogurt with strawberries? You don't.
And they try and make you pay more then to actually buy foods that have less added things in. So you want to pay for a more pure form, which should actually be cheaper. They make you pay more for it, so you have to
But also they'll say no added this, no added that. But they don't tell you things that they have added. So by saying no added sugar, no added this, you think, it's just got to be healthy. No. Not true. Okay. You okay? Yeah. Okay. Now, what age did your little man go to school?
3.
3. Okay. Any problems leaving you? Any separation issues?
No.
No? In school, any issues socialising?
Yes.
Explain.
Couldn't form friendships at all.
Mm-hmm.
But to be honest, didn't really see any need to want to. Was very, particularly in the playground, he wore out numerous pairs of shoes because all he would do would just spin in a circle. Would probably have more, I would say, female friends, using that as a loose word, because they would like to mother him and look after him. But yeah, he would never actively seek out social interaction.
Okay. All right. Okay, so what can we gain from that? So spinning is quite interesting because it's a question I would have asked later on, but that is stimulating the cerebellum, because one of the treatments I actually use is putting a child on a chair and rotating them anti-clockwise, because in your inner ear you've got what are called the lateral semicircular canals, and if you rotate the child anti-clockwise, you're stimulating the left one, which stimulates the left side of the cerebellum. So it's a very easy way with a young child of, say 2 or 3, to be actually, because you can't say to a child, I want you to do this for this reason, or they're not physically big enough to do other things. So you can do spinning. So a lot of kids will spin themselves to stimulate themselves. Playing with girls. Why would this boy want to play with girls? But girls are safe. Yeah? They're less aggressive. They're not going to do rough and tumble stuff to the degree that boys will do. And as you said, they mother you. So if you're struggling a little bit, you ladies, well, you girls are brilliant You know, there's nothing better on the planet than a mother, you know? And so, girls will mother the little boy, make him feel secure. Whereas boys may want him to do rough and tumble stuff that he thinks, I don't want to do this, whatever. So kids often avoid stuff because they feel they won't be any good at it. They don't know how to do it. They don't know what the language is. They can't read the body language. It can be really tough. So that's an important bit of information. It is unusual, though, to be, because kids go to nursery, preschool, but to be going to something you're calling school at 3 is really early, isn't it? Yeah. Okay, so going back to going to school initially, any aggression from him?
No.
No? Was he ever bullied?
No.
No, that's good. Okay. Between the age of 3 and 5, did he have imaginative play? Could he create play situations? Could he fantasize?
No, it would be based on things that he'd seen or watched. It wouldn't be imaginative.
So getting, when I was a little boy, we'd have toy cars and we'd drive them into a garage and things, nothing like that. So what would he do if you were at home with him? How would he play? What would he do?
He liked building towers.
At that age, going back to when he was, how old is he now?
Now he's 16. But when he was between 3 and 5, he would like to build towers.
Yeah.
He would have cars. He wouldn't actually necessarily play. He would collect. He liked collecting things. So he wouldn't, had no interest in drawing or painting or playing with Play-Doh, so nothing sensory like that at all. He would probably push a car back and forwards, but wouldn't actually kind of have a imaginative play with it. He might actually have the vehicles and line them up. He'd also sit there for hours and just spin the wheels as well.
Yeah. Okay.
Yeah.
Okay. Where does imaginative play come from? Where in the brain do we do it? Eh? Right brain, yeah. Right brain is where children make up things. Our youngest son, when he was very young, he had an imaginary friend called Mickey Muckle. And Mickey Muckle lived at the other end of the village. And it was all, very well organised in his brain, his right brain. And one day, as we were coming back to the village, as you come into the village, there's a row of houses, and Mickey Muckle, this imaginary person, little boy, lived in the end house. So my wife stopped outside the house. And I said, why have we stopped? She said, I wanted to see if Mickey Muckle was in the garden. So I said, oh, right. I said, well, you better get out the car. So she said, why? I said, he's just got in the house. And he got out the car, gone into the garden, through the garden, and in the open front door. Well, it's one thing to go to somebody's house and say, sorry, can I have my ball back, please? But to actually go and say, can I have my child back, please? But to him, this was so real, this, right? Now, yeah?
Probably is healthy for some children, having these imaginary friends. When would we say that having these imaginary friends are unhealthy for a child? What kind of signs we need to look?
But to a certain extent, we all have imaginary friends. You in particular, because I'm worried about you. No, I mean, we all put ourselves in places where we need to we feel safe. So, because of this age of technology we live in, a lot of children are struggling to get to sleep because they're either too excited from what they've been doing or they've had too much screen time. And we don't realise how much light comes off this technology that we use. I'm very naughty. I used to smoke a pipe, and now I've got this thing, right? Now, when I press the button, a little light comes on, yeah? Well, if I did that in a darkened room, I can use this as a torch, right? Now, because there's so much light in here, this isn't bright at all. But if I shone this in your eyes in a dark room, it would you'd be backing away. So kids have problems getting to sleep. So one of the things I always say is, okay, I said, you get into bed, you all snuggle up and, get comfy. What do you then think about? And the thing is, that if you're thinking about anything that's too exciting or anything that's scary, you can't sleep. So my answer is to have somewhere you can go. So a lot of kids with their games they play are building things, aren't they? Minecraft and that sort of stuff. So I say, okay, well, why don't you, and I tell them a story which isn't true. I say, when I get into bed and I get all comfy and snuggled up, I've got this amazing boat. If I say Gin Palace to you, you'll understand. It's an amazing motor cruiser, and it's on a big river in France. So whenever I get into bed, this is what I tell the children. It's not true, of course. Yes, it is. I go to my boat in France, and I decide what I do. I might need to go shopping, or I might decide I'm going to untie and I'm going to go down the river, and I'm going to visit some friends who live further down the river and whatever. So I tell the kids, if you do this, you're controlling the thoughts of what your brain's doing. You're not being controlled by those thoughts. Because if you're worrying about you upset your friend, you've got an exam tomorrow, whatever, your brain is controlling you. Whereas if you're going to your magical island or your castle or whatever, you're controlling your brain. And so there's tricks you can do. So having imaginary friends is a good thing. But it's like anything else. When does, say, drinking alcohol become a problem? Because I've been given a couple of bottles of wine, and I'm going to have a 4 or 5 hour journey to get home. When I get home, I'm going to sit down somewhere with a glass of wine and my little dog, and I'm going to chill. Would you say that's okay? Yeah? Okay. I'm going to sit down and I'm going to drink a whole bottle of wine. Is that okay? I'm with you. Okay, I'm going to drink both bottles of wine at one sitting. Yeah? Now we're getting silly, aren't we? So really, with all things, you have to decide what you consider to be normal. If we take subjects like OCD, superstitions, whatever, we're all superstitious. We all have OCD. Don't tell anyone, but my wife has got a bit of OCD. And so we've got a larder cupboard. And if you look at it, all the tins are lined up like little soldiers. And they're all facing, the right way and all the rest of it. So if my wife annoys me, I go in there early in the morning, turn tins round and put vegetables in with the fruit in amongst the meat and fish. I do everything. Then I deny all responsibility. Yeah? Have you heard of misophonia? Yeah? So misophonia is, it's rather like OCD, but it's reacting to a sound.
Yes.
And us poor males are usually the subject. It's usually ladies who can't stand the noise that a person makes when they're eating, snoring, or even breathing. How am I meant to stop? Huh? So it's a degree of something which it becomes abnormal. So if I have an imaginary friend, right? So I might go to my luxury yacht where my friend lives, right? My girlfriend. Is that weird? No, I feel comfortable in my imaginary world. Well, we aren't going to have any arguments. We're not going to have any fights. We're not going to have any financial problems. I'm chilled. I'm happy. Yeah. So if a kid's doing this and it gives them comfort, yeah, if it starts intruding into other areas, then it's becoming a problem. But if it's just a comfort, yeah, we all do things for comfort, don't we? Yeah.
I remember hearing, and I'm going to start this by saying I am actually religious. I remember somebody who wasn't religious saying, well, every adult who believes in God is talking to an imaginary friend. They talk to an imaginary friend. They are thinking that they get a response. So, why do we say children, it's bad for children, and yet a lot of the world's population believe in, as I say, I am religious, so I'm not kind of bashing anybody who does believe in God. But
which religion do you follow?
me, I'm a Jehovah's Witness.
Okay. Because if you think about it, if you do this just mathematically, how many Jehovah's Witnesses are there on the planet? How many Hindus are there? How many Muslims? How many Church of England? How many Roman Catholics? How many Plymouth Brethren? Right? There's all these different people who believe in God. So is there more than one God, or is there only one God? I mean, it gets very, very complicated. And nearly every religion on the planet involves some OCD type activity. And the weird thing is that if you get a tumour right next to your amygdala, got one on either side, you'll become hyper-religious. So you may be going to church every Sunday, every day, twice a day, but if you get that tumour, you'll be living in the church. Isn't that weird?
What if you flip that imaginary friend on its head and children don't imagine, as I find a lot of these days, that they're not capable of imagining, doing imaginary play or forward thinking?
Yeah. I mean, that is an issue, and that's why we'll go through it more. As we won't have time to go through it more, but
Missing stages, like some stages are missing for this child, because they're missing.
yeah. Because I mean, if the right side of the brain isn't developing as it should do, this is where we fantasize. This is where we create things. So it doesn't matter whether you're playing with physical objects and, making a garage and driving all the cars into the garage or whatever. That's right brain activity. And if you're imagining things, fantasizing, if you've got a really boring form to fill in, it's going to take you a couple of hours, you'll fill in all these boring questions, and then you're thinking, God, if I'd have gone on that holiday to the Maldives, I could have been in one of those huts on stilts over the sea, and it's got a glass floor, and the shower's outside. I can be, we all do it, don't we?
Of course.
Yeah?
Well, you need to do that from a point.
I'm going to be having a collection at the end of this little talk to try and fund my trip to the Maldives. Yeah, I mean, one of the problems about the age we live in now, all this technology, I mean, the changes happen insidiously. Like, when was the last time you wrote a check? Someone offered me a check the other day, and I always said, what's that? Huh? Why would I want a check? I'd need to have a check thingy, paying in book. I'd literally have to... Look, this is my phone. It doesn't do apps. Doesn't take... I can't do selfies or any of that sort of stuff. No. No, I mean, the thing is that things change and we don't quite realise that they are changing. And the thing is with screens, as I said, you see children in their little pushchair things, and they've got, yeah?
But I think it's not just the screens, it's also, I don't know, because I grew up in Malta and it was very academic oriented, and similar to Asia, where it is more academic oriented, and I think children didn't have the opportunity to use their imagination as they should have in their development.
Yeah, yeah.
So and it wasn't, it was pre-technology time.
Yeah. One of my grandchildren, I was talking to the taxi driver who was bringing me up here about this, and he, I don't know the technical word for it, he does videos all about roadblocks, right? And he makes, he does these programs on YouTube or whatever, and he just talks about roadblocks. And he makes videos where he puts himself inside roadblocks. So he's literally in the thing, right? And he makes a fortune. He recently bought a house, and he said to his financial advisor, he's 24, he's got a financial advisor. And he said, I want to buy this house, what's the best way to get a mortgage? And they said, just go to the bank. He said, well, wouldn't it be better to go to a mortgage? He said, go to the bank, tell them what you want. So he went to the bank, he said, I want to buy this house, it's so much money, blah, blah, blah. And they said, okay, that's fine. Do you want to put a deposit down? He said, yeah, I'll put $250,000 for 24. By just doing this Roblox stuff. I mean, and I've watched it, it's absolute crap, right? No, I was talking to the taxi driver who had to bring me up because the plane was cancelled because the pilot was ill. Yeah. So I was talking to the taxi driver about screens because he's got young kids, and he was saying, they get obsessed with this stuff. And the thing is that it's mindless, isn't it? If you look at, my wife went through a phase of Candy Crush. I thought, what are you doing? Were you born to have a life to go do, 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 do? No, it's mindless, isn't it? Yeah? But kids aren't playing so much now. They're sitting, and it's causing problems with physical health and mental health because kids are playing less and less and less. And if you don't play, you're the experts. You know the importance of play, but also the importance of physical exercise. Yes?
I work with deaf children quite a lot. So I'm just wondering, do you know much about brain, obviously brain activity I know a little bit about, but imagine in play they don't seem to latch on as much as, I suppose, other children who have developed.
Yeah. I'm no expert whatsoever, but the thing is, the brain, regardless, will develop its own form of play, but it may not be a play that you recognise. Because, you imagine that this is how you play, doesn't mean to say that that is the way it is. Yeah. Do you do sign language? I hate you. No, I think it's very, very clever to be able to do that. And as I said, last time I spoke to this group in Bristol, there were 2 ladies there doing the signing and saying very rude things about me. They weren't actually, but they were talking about me. But of course you can't hear, can you, when someone's doing all this business? Unaware.
Lovely. Can I just ask, because we're running out of time.
Yeah.
If we're not through the assessment bit yet, and I really wanted to know what happens after the assessment.
Yeah.
Would we be able to access anything after this?
Yeah, I run courses, which I'm not meant to advertise. I do run courses. I have got books. So there's a book out there, still out there, called Is That My Child? And then the new book is called The Myth, and that explains my basic theories, but what I do, it's got case histories in and everything.
Right.
Yeah.
So, because of the things that you talked about, the mega things that does the peripheral vision, the child cannot
Magnocellular.
magnocellular. So you said that if that doesn't function properly, there's an ADD and all that misdiagnosed.
Yeah.
So in your training, if one was to do the training, is that something that you can address then with a child?
Yeah.
Okay, so like sort of using the neuroplasticity.
Yeah, I mean, if you know where the problem's coming from, then you can use neuroscience to think, okay, how can I stimulate that bit of the brain, but not that bit of the brain? And in the brain, you have this process that's called diascasis. So if the cerebellum on this side is not working properly, this side of the brain can't work properly. So if you think, if I've got a factory that makes motor cars, and you've got a factory that makes the seats for my motor car, if you go on strike, eventually I can't produce motor cars because I haven't got any seats. So I haven't got a problem, but your problem has caused me a problem. So we call that diascasis. And so sometimes in the brain, one bit will pack up and that affects something else. Well, if you know these connections, you can say, if I stimulate this bit, like the magnocellular area, I know the magnocellular area talks to the frontal pole, and I know the frontal pole talks to the anterior cingulate, so I can get at the anterior cingulate by stimulating the magnocellular area. And so you can use these pathways to affect it. So yeah, you can do that. So the simplest answer to the question is, if you go to Amazon and put my name in, just put Robin Pauc, handsome guy, babe magnet, and you'll see my books come up. Most of the books are on there.
And do you do that by stimulating the sensory system?
Well, it depends. I mean, I use physical stimulation to help the cerebellum. I do diet supplements, and then I use a load of computer programs which are designed to stimulate specific neuron fields.
Like with electrons or something?
Well, just by lights, colours, movements, whatever. Yeah.
Would you be able to show us some of the computer programs? I know you mentioned it before, but I don't know the answer.
The answer is no, because we've got 10 minutes left and it's not going to happen. Basically, how can I do this? I'll have to come up with an answer for you, but it describes it all in the book. Okay.
I'm quite interested in technology.
Yeah, I mean, basically, if you look at the sort of the big boy books on neuroscience, it tells you what specific neuron fields respond to. So if you can create it in a program that's child-friendly, so I will get a kid to be looking at a Where's Wally book while some flashing's going on the screen. Because of the position of the screen, the book, the child, the stimulation will only go in the left eye, which will cross to the right brain, which will stimulate the right magnocellular area. And stimulating the frontal pole, make sure that they are looking where you want them. So you can control the child, even though they want to do this, because that's what they're meant to do. They have to override this reflex and keep looking straight ahead. So yeah, it's easy. It's easy to do once you know the
You need to know the...
yeah.
So what's it called, the approach that you use? What name do you give to it?
Well, what I do is called functional neurology. So in the old days, we say this lady lost the use of one side of her face or lost the power of speech, couldn't use her arm, whatever. If we couldn't cure her, she'd die, and then I'd take her skull, top of her skull off, and say, oh, look, she's got a tumour here, or, oh, look, she's had a bleed there. And that's how they used to do it, gross sort of problems. So nowadays, we look more at physiology as to what's going on. So, most kids haven't got a serious problem, but something has glitched, something's not working quite as it should do. So if you can identify it, you know what it should be doing, and you stimulate it, then you get it better. Get it to catch up with where it should be in terms of its growth and development.
Are there many people like you that do that?
They're not as good looking.
Clearly not.
No.
I'm just wondering
No, there's very few people, but more and more people now are beginning to think as I think, because I belong to various groups like academia and whatever, and ResearchGate, and they will send me sort of things and say, so-and-so in Australia just read your paper on so-and-so. 7 people in Russia have just read this paper, and you know what's going on. And then on academia, they've just got a new thing where you can do academia letters. And you write a letter about your current research, what you're doing, what your hypothesis is, and then other people react to it. And when I was writing about, I've done 2 papers recently, Myths and Mistakes in Neurology and A Symptom of Our Time. And these are letters on academia, which you can access if you remember. And the response to them was absolutely, from my point of view, fantastic, because people were saying, well, that's exactly what I've been thinking. This applies to psychiatry, not just children with learning and behavioural problems. So it is changing. It will happen. So that's why I'm quite happy to come to somewhere like this and talk, because it's spreading the word, and hopefully it's it's words you want to hear, hopefully.
Translating it to working with parents, we can't yet send them specifically to anywhere to say, like, if you have the resources, is that, something that...
No, the thing is that what you can say, because some of the people who come to me for training, they can be school teachers, all sorts of people. What they can do is observe and understand what's happening and have a different way of reacting to it. Or they can say to the parents, had you thought of this? Have you thought of that? Because what tends to happen is the school decides the child needs to see a psychologist, and then the ball starts rolling and the child ends up with a label. Well, that hasn't done anything for the underlying problem, because nobody understands what's actually happening in that child's brain. Yeah, you need to learn a little bit about the parents, parenting skills, the environment they live in, whatever, what they're eating, what they're drinking, what exercise they're doing. You need to find out about the life. Because if I was teasing this morning about the vodka, but if I was literally sitting up there with a bottle of whiskey and pouring out 2 inches of whiskey, drinking it and pouring, you'd think that guy's got a problem, wouldn't you? No wonder he's talking rubbish. I mean, he's polished off nearly a whole bottle. So if you're eating the wrong food at the wrong time or whatever, it's going to affect you. If you're not having any exercise, if you're having too much screen time, it's going to affect you. So you have to build a picture of why this child is happening, why this is going on. And then you can apply, the appropriate answers to the problem.
But what do you say to the parents who are persistent saying, my child's got ADHD, I know he's got ADHD, he's got ADHD, I want him diagnosed, and 80% of
well, the thing is that,
diagnosed with something.
Yeah, some parents, they've got into this rut where you have to use the DSM, you have to get a diagnosis, a pigeonhole, whatever.
£300 a month usually.
Yeah. There's nothing you can do about it.
And there's nothing you can do. The parents
Now, the
have
old
power.
expression, you can take a horse to water, but you can't make it drink.
And in schools now, there's the autism pathway, so straight away in school, the parent comes in and says...
At the moment, it doesn't matter what you do, you'll be diagnosed as having ADHD or autism.
I think
Yeah.
the process is so long to get there that at the end of the day, the parent would want a diagnosis.
The way it's going at the moment, you'll probably have dementia before you actually get your diagnosis. Sorry, I've neglected you.
Assess any child that displays some sort of issues, I would say, matters.
Well, at least 20% of children, again, it depends on where you are in the world, will manifest some sort of symptoms. So it could be dyslexia, dyspraxia, attention deficit. But they always appear in comorbidity. You never ever get a child with just dyslexia, just dyspraxia, because they're signs and symptoms of a brain that's glitched. They're not diseases, disorders. But that's where the system goes wrong, because they're trying to make every child have a condition. They're not conditions, they're symptoms. If you go to the doctor and you say, "Doctor, I've got a headache," you've got headache disease, you think, what's the matter with him? Huh?
Yeah.
So what you've got to say is, what else? Okay, you've got a headache. Have you got a temperature? Yeah. Have you got a rash? No. You need to work out why you've got a headache and what else is happening. I'll give you a thing here, prescription, headache, disease, take these paracetamol. Off you go, you're happy. Right? Stupid. Yeah? It's 5 o'clock. These gentlemen who've been hiding in the corner, playing cards, want to go home. I've got a young lady to meet, Evelyn, who's going to take me home. And I just want to say thank you for being here. I've loved it. Have you got to hand these out?